cylinder here, so you can imagine a can of Play-Doh or like a toilet paper roll, and you want to keep this as one cylinder. When you break that cylinder, that is when you are putting the back at potential harm, or at least... Hey everyone, Dr. Alex Ritzy here, and in this video we're going to talk about why a lot of my patients will get low back pain after a squat, a deadlift, or some other back exercises at the gym. One of the most common problems that we see, especially those in their athletic, that we take care of, and if this has happened to you, it can usually reflect one of two problems. Either A, there's a problem with your spine, or B, your technique is just not good, or I guess C, some sort of combination of the two. If we think about it logically, which I like to do, when a muscle gets sore or tight, assuming it's the latter option, that it's a technique issue, when a muscle gets sore or tight, you can just think about it like if you were to repetitively do a dumbbell curl or hold a dumbbell curl all day, that muscle is going to get sore, it's going to get stiff, and it's going to get tight because you are straining it above its means, above its capacity, and that's how we get stronger. But when it comes to the low back, that deep, DOMS, insidious muscle tightness can be really debilitating, and if repetitive, can lead to some issues with the spine. So usually why that happens is because, just like the bicep, we're using those muscles in the back too much to bend backwards instead of using the glutes. So what you can do is a little experiment yourself. So let's say you wanted to come to an upright position. If you squeeze your glutes, that's going to stack your spine up, and my low back muscles here are nice and soft. Now, if I were to squeeze my glutes and then extend my back more, you'll feel those low back muscles here pop into your hand. And so when those low back muscles pop into your hand, that's when you're using them maybe excessively, and you're at risk of making them more sore. And if that's something you want to avoid, then you're going to listen to these tips. In general, for doing any low back or any spine exercises, we want to be using our bigger, stronger glutes anyways. So even if you're trying to target the low back, the glutes should be doing the majority of the lifting because they have a better mechanical advantage, and just size-wise, they are much, much, much bigger than the low back muscles. So let's say we're doing a deadlift. So with doing a deadlift, if you look through our movement curriculum and our corrective exercise part 1, which I will link, you will see that when doing a deadlift, all it requires is a hip hinge where we're sticking the butt back and the spine stays lined up. Now, if I were to break that spine angle, you will see that my belly button comes forward and you would feel your low back muscles tighten up. So when somebody is reaching low to the ground, they're going to have to use their back if their glutes stop going backwards. So they're going to have to hump in the spine and then forward with the hips. So if this is something that's happening to you, what you want to practice is using a dowel, a golf club, a hockey club, and really ingrain that hip hinge pattern. And any time where you lose contact with the head, the mid-back, or the low back, that is when you are going to strain the spine more and shift the effort away from the glutes. So when you shift that effort away from the glutes, that is when you're going to challenge the spine more, use those muscles more, use the less mechanically advantaged muscle, the low back muscles, more likely to strain them. So when I'm teaching somebody a deadlift, we go over the hip hinge, we teach them the hip hinge, and for me, that's as low as I can go without bending my hips, and if I want to go lower, I bend my knees. Because if I want to go lower, I have to bend my spine, and that is going to put it in a compromised position, or a compromised position. Even here, I'm having to bend my knees. So if you want to protect the low back, that's what you want to do. You want to make sure spine stays straight, ear, shoulder, hip in a totally straight line. You can use your golf club or your dowel. And then another thing that people will make a mistake of is when they come up, you want to just squeeze the glutes like you're squeezing a dollar bill between the glute muscles, and that any excessive extension is going to activate those low back muscles, more likely to make them tight. So that would be bad. That would be good. Just squeezing the glutes, bringing the belt buckle forward, spine is still aligned. If you need a different visual aid, which I will try to do in post-production, you can imagine a cylinder here, so you can imagine a can of Play-Doh or like a toilet paper roll, and you want to keep this as one cylinder. When you break that cylinder, that is when you are putting the back at potential harm, or at least not having a good mechanical advantage for the glutes and the muscles. So we don't want that cylinder to break. We want to stay the hips in line with the rib cage, and we want to keep that cylinder not from breaking. So anytime, well, usually in the gym, if you're getting some muscle stiffness from a particular exercise, it usually means that that muscle is being used excessively or beyond its capacity. Sometimes that's a good thing, sometimes that's going to make you stronger. When it comes to the spine, we don't want to load the spine in that way. Or if we are loading the spine, it should be evenly loaded. We don't want to focus especially on one part of the body with the deadlift or with the squat. You should be keeping that hip hinge, that cylinder lined up, and yeah, if you do that, you're going to be less likely to develop back muscle soreness, DOMS, tension, and you're going to be less likely to develop a spine problem over time. So I hope that's helpful. As always, take care. I'll see you at the next one.